FM. The ministry's social media platforms and all our websites are also those who are watching on PBCJ. Viewers can send their questions and comments via our social media platforms or text or WhatsApp platform at 876-298-6508. That's 876-298-6508 or 876-298-6258. Our call-in line is 876-618-8248. That's 876-618-8248. At this time, I invite the Honorable Minister to bring his opening remarks.
Good afternoon, Robert. Good afternoon to my friends and colleagues on the panel, and welcome to our listeners in Radio Land and those who are watching this town hall online. Let me welcome you to the second in a series of town hall meetings sponsored by the Ministry of Local Government. The last time we met in a similar fashion, we discussed the question of markets and food security. This week we are back to discuss a very important topic as we look at the homeless population and we visit our infirmaries and have an open discussions about those persons who fall under the care of the Ministry of Local Government. We are faced at this point in time with challenges, and COVID-19 has brought a different challenge to our homeless population and those who are less destitute in the society. The government of Jamaica has responsibility for some 2,000 residents who reside in our infirmaries. There are also some 30,000 persons that depend on the state through our outdoor poor department and other such social services. But there is one population that many Jamaicans continue to ignore, and that population is those persons who live on the streets of our country. The latest figure that we have in our possession is pointing to some 2,000 Jamaicans living on the streets of this country. Kingston and St. Andrew bears the brunt of that population. In my own constituency in West Kingston, that population is estimated to be in the region of some 600 Jamaicans. How do we intend as a government to respond to the crisis of this homeless population? I want to make the point that it is not because of the advent of COVID-19 that we are doing what we are doing. But what this has done is to put a little bit of fire in our wings so that we move expeditiously to ensure that we provide the necessary solutions for these persons. So today, we are going to explore the areas. We're going to look at the steps that the government is taking. We're going to look at the support that we are getting both from the public and private sector. And we're going to be sharing the perspective as to how, as a nation, we should treat and respond to the crises that face this population. Over the last week and a half, we have commenced a comprehensive feeding program in all parishes across Jamaica. We are providing 2 meals on a daily basis, breakfast, dinner, and also a care package. Since we started the program, we have reached some 25,000 persons across the country, including those outdoor poor who are receiving financial assistance, and over 3,000 students who forms a part of our assistance program for educational grants. We are now creating a makeshift facility in Kingston to house 150 homeless persons. We are sure that the facility will not be able to respond to the needs, but we are looking to make the necessary adjustments to facilitate these persons. Not only are our interests in the corporate area, but every parish in Jamaica, there is a facility to house the homeless population. So today, we're going to be examining how we have been doing so far. And I want now to, first of all, Robert, look at the parish of Manchester, and the mayor of Mandeville is here, and he will now speak to the activities that is taking place within the parish of Manchester.
Thank you, Minister. Thank you, colleagues. And let me welcome those in Raiderland. In the parish of Manchester, we have been doing all we can to make sure that the homeless persons are well taken care of. Indeed, we have some 80 persons that we know of, which are being taken care of by at least 3 different groups in the parish. We have the Ebenezer Home, or the Ebenezer Rehabilitation Center. They deal mostly with the mentally challenged persons. It is actually a residential facility. It holds about 20 beds. We have Candle in the Dark, which is more of a feeding program where the homeless will walk down to Candle in the Dark, have a bath. They'll be given 2 meals per day. And that facility holds, or 20 persons can sleep. In our discussion, we're looking at putting up a tent that can hold another 40 persons on the compound. There are bathroom facilities, and there's a house mother. We have another group, Friends in Need. This is a group that feeds about 45 persons on a daily basis, 3 meals per day. And it is from persons with HIV, persons that are just on the road that walk in and have their meals. And we're looking also to see how best we can expand. From Manchester, we have just about 578 outdoor registered poor persons and 89 children. We make sure that they are well taken care of. Indeed, before the minister made the announcement of giving additional funds, we took a decision that because of the time we're in, that we would double that little money they get so that they would be able to buy enough food to keep them. What we have done is that all our poor relief officers have contacts with those persons. If the persons don't have a number, they are to get a number from someone that is living close to them. And on a daily basis, or as much as possible, to get in touch with these persons. We know their medical conditions, we know their living conditions, and we also have the churches who from time to time who comes in and help us. And so for Manchester, we're doing all we can to make sure that our homeless population is well taken care of.
Oh, thank you, Minister and Mayor Mitchell, for your opening contributions. Let me throw, if you will, Minister, to Dr. Espinosa Campbell, after which we'll hear from Mayor Richard Query in terms of the focus of this afternoon's discussions.
Thank you. Thank you, Minister Mackenzie, the other guests on today's digital platform, and I also want to acknowledge the viewers. I must say that having visited some of the infirmaries and the other indigent homes across the Kingston and St. Andrew, it was really heart-wrenching to see what was happening. And I also want to publicly commend the Minister for taking this initiative and the enhanced approach that certainly the Ministry of Health and Wellness will be taking as well to ensure that the medical needs are taken care of and the mental, the mental health are also acknowledged. So in that effort, I know that we are looking to at least do some enhanced screening in our infirmaries and also to put some measures in place from a policy directive to ensure that we don't have any sort of negative outcomes from these COVID outbreaks. So I'm sure as we go further into the discussion, we will speak specifically on the COVID response in the infirmaries.
Mayor Query.
Thank you very much, Mr. Moderator, fellow panelists, Minister, listeners and viewers, good afternoon to you all. St. Mary, perhaps fortunately, has a lesser number of homeless persons on the street. Nonetheless, we have put plans in place to take care of them, not only during this time, but it's something that has happened over time. In 2018, Minister Mackenzie provided us with funds to build a drop-in center in the town of Port Maria. And that drop-in center is there to cater to our homeless population in the town of Port Maria. So we feed them 2 meals per day. We have a retired nurse who volunteers to manage that center, and I'd like to commend Ms. Planters, who is a retired nurse, and she basically has taken that center as if it is her own. So the clients in Port Maria visit, there is facilities for them to have a bath. We provide them with clothes. We provide them with 2 meals per day, and also, since the COVID-19 outbreak, we have been provided with funds by the Board of Supervision to provide them with care packages as well. In terms of the other areas throughout the parish, we have a few such homeless persons in Gale and some in Another Bay who are also fed. What we do, we make arrangements with restaurants in those areas to provide meals for them. On the 20th of March, we sanitize the areas within the town of Port Maria that these homeless persons tend to congregate, which is the post office and that area in Port Maria. So we did serious sanitization in that area to accommodate them. We are in the process now of purchasing a mist blower, which we will be utilizing to do further sanitization in similar areas across the parish. With regards to the infirmary, we have taken a number of initiatives. We have employed additional persons, cleaners, patient care assistants. We have put protocols in place so everybody who enters, their temperature is checked. We have, as I said, employed additional persons. We did a cleaning on the 20th of March, a thorough cleaning of the infirmary. And what it showed us then, Minister and panelists, is that our infirmary was very clean. In doing the power washing, the water that was coming out was clear water. And I must commend the matron and the staff at the infirmary for keeping that facility in that condition. So we have been doing a number of things. As we go on, I can expand a little more as to some of the other initiatives we are taking.
Thank you, Mayor Query. And to close out the opening statement segment, I'm going to invite first Dr. Dwayne Vernon, the Executive Director of the SDC, followed by Ms. Trika Lewis, the Corporate Secretary of the Board of Supervision. Dr. Vernon.
Yes. Thank you, Sir Hill. Minister, fellow panelists, media personnel, members at home, good afternoon. It is critical that in this time we provide services to ensure that our senior citizens remain in touch with critical care that they need. It is not lost on us that the devastating effect that COVID has had on the senior population across the world is one where we see the mortality rate is higher at that age group. So therefore, the stay-at-home order is in effect, which is across the world as well in most countries. But being at home means that what? You need still to be in touch with critical care. You must access the supermarkets. You must access medical care. You must access those services that you require. So at the ministry, we have put in place a Rona helpline, Rona, as in Corona, Rona helpline, where there will be 18 numbers island-wide. 18 numbers island-wide, 5 alone in the corporate area because, of course, of the population. So where senior citizens at home and family members in the diaspora or family members at home, you can call into those lines where it is that a senior citizen is at home and requires critical service. The numbers are there listed on your screen. You may also WhatsApp the SDC at sdc.gov. We'll ensure that we provide that response. So how will this work? when we get a call, we will get in touch with the senior citizen at home, and we will visit each home. We'll visit each home. The SDC will be utilizing our officers across the country to visit each home to ensure that the person who is in need of service, in effect and reality, is such that we can provide that service, because we want to target those persons 70 years and older and without the critical support system around that individual. Because in Jamaica, currently, about 11.3% of the population is really in the not elderly, the senior citizen category. And if we're to look at the 70 and over, we're talking about another 200,000 we're looking at. So we have to ensure that that 200,000 population is still in touch with critical care, because this is a government that cares, and the minister realizes that we must ensure that they are taken care of. Robert?
Thank you, Dr. Vernon. And Ms. Lewis.
Good afternoon, Minister, colleagues, ladies and gentlemen. As the entity responsible for the homeless program, the indoor poor, which we also call our infirmary residents, and the outdoor program, our major thrust now is to coordinate all the activities to ensure that these persons are receiving the assistance that they are in need of. Specifically, as we have the most vulnerable population, or a section of the most vulnerable population, we have put in a number of measures in our infirmaries to ensure that as much as possible, we keep the virus out, and also, if in the event that it does happen, to contain the spread of the virus. Minister would have mentioned some time ago at the cabinet press briefing that there are no visitors allowed at our facilities now. And what we have done also is to shift our entry protocol, so each person has to be screened before they enter the facility. And these persons would be just regular members of staff or service members. We are not allowing any visitors at this time. In regards to our homeless program, as Minister said, this is not something that is new because of the virus. Over the years, we have been reaching out to our homeless population, and in each parish, we actually have a solution that caters to the needs of the homeless, whether it is through a feeding program or a shelter program. And each parish, as I mentioned, would have had a solution. What we have done also is partner with other agencies or faith-based organizations who have the same mandate as us, and we give some level of support to them for them to reach the same clientele that we would have the mandate to provide for. In regards to our outdoor program, we have a number of social workers, poor relief officers all over the country who have been doing a tremendous job, and I would also like to commend them for the work that they have been doing. And even now, it is more poignant that they are out, so we have increased our social work activities. As Mayor Mitchell would have mentioned, our poor relief officers are tasked to now monitor the elderly residents, the elderly outdoor poor recipients who are more at risk at this time. So we have more of our social workers going out, checking up on them and delivering the care packages that they would need. Also ensuring that they stick to their medical compliance regime. That is it in a nutshell for the program.
Thank you, Ms. Lewis. Thank you, Minister and panelists. As we shift swiftly into our response in terms of questions that would have come via our text line, Facebook, Twitter, and of course our websites, I'd like to, with your permission, Minister, just to reiterate many of the items and things that have been said, because this has indeed generated much traffic across the media landscape. For example, on Tuesday, March 17th, there was an article in The Observer which spoke to how the mentally ill can also be part of the national plan, and that has been taken care of under this program as well. In the Gleaner of Monday, March 30th, 2020, where it says the homeless get a food lifeline. This proves that there has been more than an effective response and a complete response in dealing with the vulnerable in our society. The first question, of course, comes from TBJ, Mr. Vashon Brown of TBJ, which is a four-part question. It says here, what plans are there for the shelter on Church Street? We were told that there is no shower or fan in place. Any idea when these will be put in place? The second question, do you have medical staff that check the temperatures of the persons who visit to ensure they do not have the virus? Number 3, what happens if someone has a flu or fever-like symptom? What do you do? And question 4, what are the long-term plans to deal with the homeless situation in the corporate area and Jamaica in general? Those questions are from Vashon Brown of TVJ.
Let me, first of all, respond to the first question posed by Mr. Brown. The facility at Church Street was a last-minute result. In 2010, at the time I was mayor of Kingston, we came up with an idea to create a facility at the top of King Street to deal with the homeless population. The funds were provided, the drawings were completed, everything was put in place for the facility to be built. I left the KSAC at the time, went on to become the Member of Parliament. And all the plans for that facility was swept under the carpet. We lost the money to build the facility. Nothing was done to improve the conditions of the homeless, especially in the corporate area. In 2016, when I became the Minister of Local Government, we took back the initiative to start the construction. The design for the building has been completed. We broke ground last year, and the project is now going out to tender to build a modern facility at the top of King Street to house the homeless population, to provide the same medical support and to give them a shelter in times of difficulties. The facility that we are now using at Church Street is a makeshift facility. While we are housing them there, we are working to improve the facility. So there's no truth that there are no bathrooms, that there are no sanitary facilities there. There are sanitary facilities. If you say to me that it is inadequate, I will say yes. And we are now working to improve those facilities to ensure that the persons who are turning up, and let me say, since the center was put into motion little over a week ago, we have had more than 250 persons turning up, sleeping, getting a bath, getting medical attention, 2 meals a day. That never happened before. And this is going to take some time for us to put this facility in place. So in response to your question, Mr. Brown, yes, the facility is up and running. We are still working on the facility. You asked if we have medical staff there to do the temperature check. Yes, that is done. Every individual who comes into that facility, their temperature is taken, we check on them, and Dr. Campbell did explain that they are working with us to ensure that that medical side of it is dealt with. So I'm going to ask Dr. Campbell to respond to the question you raised, which is if someone has a fever or a flu-like symptoms, what do we do? So Dr. Campbell.
Thank you. Thank you for that question, Mr. Brown. It's a very relevant question since we're not only dealing with COVID, but we also have to be mindful that we're also in the influenza season. So we're also seeing influenza-like illnesses and other types of respiratory illnesses. So in response to your question directly, how do we deal with fever? Once we recognize that there's fever within the facility, the first job is to recognize it and to isolate those persons who may have the fever. And certainly to get the medical doctors to check them out to ensure that this is not COVID related, or to see where the source of the fever is. And certainly within the facility is to contain the fever so other residents are not affected. And we have discussed this with the Ministry of Local Government. There are protocols in place to curtail this. And I'm very happy to say that having visited the facilities, there was recognition that an isolation unit ought to be created specifically for those persons who have fever. Because one of the imperatives that we have to look at is to prevent spread of any type of respiratory illnesses within the confines of the infirmaries or any other long-term care facilities that are in view right now. So yes, thank you for the question, and I hope I've answered it sufficiently for you.
Now, I want to also respond to the last question that he asked. What are the long-term plans to deal with the homeless situation in the corporate area and Jamaica in general? Now, let me explain that there is facilities, as I said before, in all the parishes in Jamaica to facilitate the homeless population, those who are willing to go into these facilities. Not all of them will want to go into the facilities, but we are providing the facilities across the country. And when this facility is built in the corporate area, it will be able to house an additional 150 more persons that are living on the streets of the corporate area. And just to advise that the facility that we are now using at Church Street, we will also upgrade that to be used as another facility in the corporate area. So the corporate area will have at least 4 such facilities, because we have the open arm facility out at Windward Road. We have the Marie Atkins facility at Hanover Street, which is bursting at the seam. The one now at the bottom of Church Street, and the one that is going to be constructed later on this year that will probably take care of a significant portion of that population. And as I said before, we have facilities right across the country. But let us not fool ourselves. Not many of them will want to stay in these facilities. We have had the experience where they will come, get something to eat, get a change of clothes, and then they go back to where they are. A lot of them feel comfortable out there. We can't force them against their will. And we must also remember that they are not just normal street persons. There are also persons there that are of a mental situation, that have mental health problems, which also creates another problem. But just to say, Mr. Brown, that this administration will do everything in its power to ensure that no one is left behind.
Thank you, Honourable Minister. There are some direct questions for both our mayors on panel. And first, I'll focus on St. Mary. Mayor Query Maud says wants to big up the mayor and councillors to continue to do a good job. Agatha is asking how she can get into the infirmary. And the other one is concerns Jamaican, based on what is said about coronavirus. What steps are being taken to ensure the safety of the residents of St. Mary? Nursing homes in the U.S. are seeing numerous deaths, and I'm hoping all precautions are being made to protect our infirmaries from COVID. I believe that's a question both for Minister as well as for Mayor Query, and of course, Dr. Campbell.
All right, I'll answer with regards to how can someone get into our infirmary. Right now, our infirmaries are not admitting any new residents due to the COVID-19 situation. Once it is behind us, at present, actually, our infirmary is full to capacity. We have 85 residents, 54 male, 31 female. And it is of note, Minister, I don't know if it is coincidence, but we find that there are more male in most infirmaries, and also in the outdoor poor, there are more male than female.
Yes.
I don't know if this means that Jamaican men are worthless, but it's something worth looking into. But after COVID-19 has passed, as Minister is hearing that actually St. Mary really needs another ward. Because as I said, for some time we can't pass that number of 85, yet there are other residents who would like to enter the infirmary. So we really need an additional ward. There is a facility that was constructed by me through funds I raised by keeping the mayor's ball when I was previously mayor, and we built a recreation facility that can be converted into a ward. We need to look as to how we do it. We have determined now that once we have cases, we might need to use that facility to house as an isolation area. We are also, look, the matron's quarters, which was in disrepair, we have started the repairs of that matron's quarter to use as an isolation area. So the quick answer is no, nobody can be admitted now, but we will look into it at the end of the COVID-19 situation to see how we can accommodate additional persons.
Doc, you want to take the question about the concerns? What are the steps taken to ensure the safety of residents? I think we have spoken to that again, but you can it is not too much to repeat it.
That's correct. So what we have recognized is that, one, we try to prevent any sort of infection from coming into the long-term care facilities in the first place. And you would have heard me mention also that if it does come in, it's to be recognized and persons are to be isolated and treated quickly, and also to prevent, any sort of infection from going back into the community. So if you're entering the facility, if it's to be allowed in extreme cases, of course, then certainly you have to follow the protocols, wash your hands for at least 40 seconds, or use an alcohol-based hand sanitizer for at least 20 seconds. If you're having symptoms, we really don't encourage you to come there in the first place, but certainly you would have heard the Prime Minister mention that if you're going into any sort of crowded places, you ought to now be wearing a mask. So the matrons are well-versed on the precautions, especially as it relates to touching fomites, contact surfaces, door handles, bed rails, etc. And of course, the cleaning schedules are to be implemented twice daily or more if there's extra dirt or soiling within the healthcare facilities. So certainly all those infection prevention control measures are being implemented, and more so now that we're in the COVID outbreak. And just to mention, the figures that we have for Jamaica are very encouraging. We only have 4 deaths so far. And for St. Mary's specifically, just 1 confirmed case of the COVID-19. So that also is encouraging. And, we have 63 confirmed cases to date. Today is the 9th, and we have 63 so far. And we've done many other tests, almost 800 tests, most of which have come up negative. So that, too, is to be applauded.
Thank you. I'm sorry. May I go ahead, Minister?
Yeah, I would just probably ask Ms. Lewis to just expand a little on the additional steps that we have taken in the infirmary to ensure the safety of the residents, the things that we have put in over the last 3 weeks.
Okay, thank you, Minister. So, since the advent of the COVID-19, as I mentioned before, our entry protocol has changed. So on entering the facility, and these are the staff, there's a screening process that the staff members go through. You have to have your temperature checked, you are sanitized, and also your street clothes are not allowed to enter onto the wards or the facility. So there's a changing area on entry to our infirmaries. We commenced a mass cleaning and sanitization program that lasted 3 days of all our infirmaries. And to maintain that cleanliness and sanitization, we have had additional cleaners in all our infirmaries to ensure that the frequently touched surfaces are cleaned, handrails, doorknobs, etc. And that our residents we have also improved the number of patient care assistants so that there's increased monitoring for our residents in case there is anything that we need to look out for. So we have more members of staff on board at this moment.
Thank you, Ms. Lewis. And for Mayor of Mandeville, is the Candle in the Dark Center for private people or the general public? Very important question, Mayor Mitchell.
Candle in the Dark is a public place. It started by Dr. Art Reed and is now being run by Mrs. Freckleton. The ministry supports Candle in the Dark on a monthly basis. They get a subvention, which helps to run the place. There's a house mother. From time to time, we got some goods the other day from the Chinese friends, and what we did was to split it up for all of these institutions so that they have additional food to feed persons. So it's really a public institution. It's not a private institution. We don't have any such private institution except the nursing homes in Mandeville, per se.
And just to follow up on Mayor Mitchell, not only Candle in the Dark is getting a monthly assistance from the ministry, but also the Ebenezer Home and the Friends in Need. And just to make the point that the work of the Ministry of Local Government is also complemented by various other such church organizations across the country who, as Ms. Lewis rightly said, have similar programs. For instance, the Salvation Army is partnering with us in the feeding program. So we have various stakeholders that is working with the Ministry of Local Government to ensure that we provide what the necessities that are required by these persons who fall on difficult times.
Thank you, Minister. As we take a question from our text line from Kirk, has there been proper education by the government to the security officers on how to deal with the homeless when found during the curfew period?
Well, let me respond to that. There have been discussions between the police. I had discussions with the commissioner when it was brought to my attention that a homeless person was arrested during the first night of the curfew. I understand that that was not so, but what we are also seeing now is that the police is assisting wherever they find these homeless persons, not just in the corporate area, they are taking them to the facilities that is established. So yes, there is a good working relationship with the police and the homeless population because the police is providing the assistance by taking them to these facilities whenever the police encounter them during the curfew.
Thank you, Honorable Minister. And from Peter Ann Baker on Twitter, given that persons who are 80 and over are the most likely to have negative outcomes if infected, would Minister Mackenzie and Minister Tufton advise on what steps, if any, have been taken in relation to the protocols for public and private senior citizens' homes? The second part of that question, Minister and panel, have the representative of the government met with operators and managers of senior living homes? And has there been outreach to senior citizens organizations and churches, etc., with regard to addressing the particular needs of older persons who live at home and use the services of a care attendant?
I think I can handle the first part of that question. In terms of the public education, I think, between the Ministry of Health and Wellness and the government, of course, a lot of information has been put forward on a number of platforms, both in the print media, there are, brochures, digitally. I mean, everywhere you look, there's something about COVID-19. Specific to the nursing homes, I know the information has been sent out through the matrons that operate the nursing homes. And yes, we do agree that those persons 80 years and older are more vulnerable to the adverse effects. And this is why there is an enhanced surveillance exercise within the nursing home to prevent the COVID from entering the facilities in the first place. And, the fact that we have had none so far is really testament to the hard work of our frontline staff. The nursing care has been exceptional in all our healthcare facilities, to include the infirmaries. And, we do applaud their efforts. And we also are cognizant of the fact that we have other agencies, such as the Red Cross, St. John's Ambulance, have volunteered their services to help us. So if the need arises that someone needs to be hospitalized, not only do we have the Ministry of Health and Wellness ready to take those persons, but also the non-governmental organizations have really added impetus to getting persons treated effectively.
And let me just also follow up on that. The Jamaica Fire Brigade has a medical response component in its armory, and we have already also made arrangements with private ambulance suppliers across the country in case there is a need for ambulance services. Those services will be readily available. I just want to make the point that we have sat with the Ministry of Health and we have explored all the various possibilities of what can take place, and we have put the necessary contingencies in place. When Dr. Vernon spoke about the Rona program, when he spoke about the Rona program, one component of that is that the government have now lowered the age of staying home to 70. Now, there are cases where persons might have a medical appointment, needs to get to the doctor, but can't get to the doctor. We will be able to provide ambulance services once we are called to provide those services. So in response to the question, the government has taken all the necessary precautions that is possible to ensure that we are able to respond to any concerns that are raised by any level of the society, whether you are 70 and over or 20 going down, whatever, we are in a position to respond as a government.
Thank you, Minister. And going further afield, Ms. Mildred Johnson of Bull Savannah and St. Elizabeth. I believe this question would be fitting for Ms. Lewis. She says that she was visited and interviewed for the Poor Relief Program over a year ago. Can she get some information?
Okay. The Inspector of Poor normally has to do an investigation before, and also there is a medical that has to be done by the person who applies for the Poor Relief Assistance. What I will do, Ms. Mildred, is to give your name, and if you want to send us some more contact information, and I will get in touch with the St. Elizabeth Poor Relief Department, or I'll also call the Inspector of Poor and see what has happened to your situation.
Thank you, Ms. Lewis. Question from Dervin Malcolm of Power 106 FM through Facebook. A caller yesterday suggested could convert containers into shelters for the homeless. Would you consider such a move, Honorable Minister?
Well, as far as we are concerned, anything that will be able to ease the burden, to get them out of the streets at night, to put them, we will consider that. So that is something that we will look at and to see how possible that will work. And once it can, we will make the necessary adjustments.
Thank you, Minister. A question from St. James Anonymous. An unemployed mother of 10 children with no means of income has a daughter that attends the Montego Bay High School. The child is assisted by the Poor Relief Program at school. And her question is it possible for 2 more of her children to be considered for the program?
Yes, it is possible for additional persons to benefit from that household for the Poor Relief Program, as long as they're of school age. And this information, again, will be passed on to the Inspector of Poor for St. James. So there's no limit on the number of persons that we assist per household. As long as the need is there and the resources are available, persons will get the assistance that they need through Poor Relief.
Thank you. Another question coming from St. Elizabeth. Alva Murdoch asks, how can she get 2 elderly persons into the infirmary at Santa Cruz? And if there's a fee for them to stay at the infirmary.
Okay, so there's no charge to stay at our facilities. They're government-run, government-owned, and therefore they're free. There's a criteria that you have to meet in order to be admitted to the facility, even though Mayor Query already mentioned that at this point, we're not accepting any new admissions. And the sad reality is a lot of our facilities are already at capacity. However, the process is you speak to the inspector for the parish, an investigation is done. If you meet the criteria of destitution, not having the family support to care for you at home, then you may be admitted to the facility as long as there is space.
Thank you, Ms. Lewis. And we just want to remind our viewers and participants that are joining us on Nationwide News Network, NCU FM, Power 106 FM, and Mellow FM, as well as the ministry's social media platform. And those who are joining us on PBCJ, our text and WhatsApp lines are 876-298-6508 and 876-298-6258. Or the toll-free line is 876-618-8248. As part of the ongoing activities and thrust in this area, Minister and panelists, we just want to bring some attention and focus to what has been done so far. There's funding of about $66 million to provide the elderly and children who are registered poor in all parishes, distribution of donated items from our donors and partners who include Food for the Poor, Grace Kennedy Foundation, the National Health Fund, Salvation Army, Denos and Geddes, and PAD developers. As we continue with some more of our questions, Minister, there is a question of concern coming from Westmoreland, and it asks, why is nothing being done for the poor and homeless in Westmoreland? Is there a feeding program for the poor and homeless on the streets of Westmoreland?
Well, let me say that I don't know if that is totally true. I am aware, based on the numbers, that for the parish of Westmoreland for the week ending, more than 20 persons have been provided with 2 meals a day. And after the COVID-19, that have been stepped up to what, 7? So we are actually providing for the people in Westmoreland. Also, there's the care package and the medical assistance for the residents in Westmoreland. Ms.
Right,
Chris?
yes, and to add to what Minister said, there is a shelter in Westmoreland. It's the Westmoreland Association of Street People, and it's on the infirmary compound, and that shelter houses approximately 20 males. Those are all homeless persons. So we do have, as we said before, we do have a solution in all our parishes. And also the Inspector of Poor has been given care packages as well as assistance for the outdoor homeless program to ensure that these meals are distributed. Where we cannot provide a cooked meal, then ready-to-eat items will be provided to those persons.
Thank you. There is a question again coming from St. James, particularly Montego Bay, asking how many facilities do we have to house street people in St. James?
Well, I know we are presently, the construction for the drop-in facility in St. James is almost 85% completed. And then there's also privately run, when I say privately run, but there's also another facility in St. James that received financial support from the Ministry of Local Government that caters for street people. Let me just make the point that the government alone could not deal with the issue of the homeless population. And as I said before, there are many institutions, churches, and private organizations that have pooled their resources together to help in this fight. And I want to make another point that is critical. We have one of the largest street population in this part of the region. So we have the numbers, And one of the most frightening things about it is that on a daily basis, we are seeing much more young people turning up on the streets. And many of them, either because of drugs, you find many deportees that have come back to Jamaica, have no relatives, ending up on the streets. And that is why facilities such as the Mary Atkins and the open arms facilities bursting at the seam, because many of those persons who are actually residing there are persons who have come back to Jamaica with no place of abode, and so we can't throw them out on the street. So the government is looking at it, and the government intends to do what is necessary to ensure that we put those necessary things in place to deal with this situation.
Thank you, Honourable Minister. And just to reiterate much of what has been said previously, particularly for the indoor and infirmaries, the sanitation exercises have been completed island-wide. The new screening protocol for entry into our infirmaries has been established. The employment of additional staff for cleaning and screening is also in place, and infrared thermometers and motion hand sanitizers in use at all facilities. There's a question, Minister, coming from Twitter. Mr. Kamar Daswell asked, we are at home in our beds. What about the homeless community, which we have been addressing? They can't all be accommodated in the shelters. So is there constant interaction with them to let them know what is happening?
Well, I'll take that. Certainly, as mentioned, we have put up the numbers, so you can call the numbers that you see. So you can call the Social Development Commission or the number at the ministry, and we will make contact with you to establish what sort of support you need, what sort of assistance you need. But I want to make this point very, very clear. The Rona helpline is about providing access to critical services that you need, but it is not a financial-based support. It is really to ensure that you have access to critical medical care, access to obtaining your groceries, and any other matter on a case-by-case basis that will come up. But it is not about providing financial benefits. It's to ensure that you remain in touch, and we are ready, we are willing, we will be listening. The lines will be opened from 8 to 3 p.m. Mondays to Fridays, so you can call, and we will return your call and visit your place. Of course, ensuring personal safety, of course, for yourself and our staff.
And also on that, we will also allow the officers, when they go out and they find cases where there is a need to make reference to the officers, that they will refer those cases to the officers, where the officers will go out and undertake the necessary investigation. So in response to the question from the gentleman on Twitter, is that yes, we will investigate where we find these people. And let me also say that there is a roaming team that is roaming the corporate area, going into various areas. When people will send us information, we will go there, look for these individuals, take them to one of the facilities. If the need is for clothing, food, we do so. But we understand the concerns, but we are out there and we will find them wherever they are. And that is why we are asking the public to use the numbers, not just to ask us to come to assist in getting our stuff, but also to give us information as to where on the streets, whether in the corporate area or right across the island, where these people can be found.
Thank you, Minister. There's a question from Clarendon. Ms. Winifred Pottinger of Thompson Town says that she used to work at the Chapelton Market until she retired 10 years ago, and she has not received any pension. How does she register for the Poor Relief Program? I think that one is for Ms. Lewis, perhaps?
Well, I don't know. We'd have to check that out to find out about the question of the pension. I will take that information and we will do the check on the pension. As it relates to, what was the next part of the question?
She was saying that she's asking how does she register for the poor relief program?
Well, Ms. Lewis, just explain that you'd have to be investigated by the poor relief officer, and once your situation is considered to be one that you are really in need, then the necessary steps will be taken if the space in the facility is available. And let me just emphasize on a point made by Mayor Query about the overcrowding of the infirmaries. Since 2016, we have built additional accommodation across the country. In Portland, we have constructed 2 new facilities. Presently, the male ward is under construction in Portland. Similar work is taking place in St. James. Work is also taking place in Westmoreland and building a new ward and a matron quarters. And we have just constructed a brand new female ward.
State of the art.
State of the art. in Manchester. And we are now also building an administrative building at the St. Elizabeth Infirmary. And listening to Mayor Query's plea, we will now explore to see whether or not we can make some adjustments to that recreation center to erect another facility. I know the demands out there is great. The last count I got was that there are over some 350 persons who are waiting. The Vineyard Town Golden Age Home is now under the direct control of the Ministry of Local Government and also the Denham Town Golden Age Home. And there are also persons waiting on a list to enter these facilities. In the case of Vineyard Town, we are going to be doing some retrofitting of a number of clusters there. One, to house persons who are social cases in the hospitals. I understand that there are some 130 beds that are badly in need, that persons have been in the hospital for many years. They are not sick, but they have nowhere to go, so they continue to occupy valuable bed space within our public hospitals. And we are doing work now at the Vineyard Town Golden Age Home and in Clarendon to at least free up at least 60 bed spaces so that persons can occupy those facilities. So we are in fact looking at all the various areas to improve the capacity of these facilities.
Thank you, Honourable Minister. As we again repeat the lines for participation, text and WhatsApp 876-298-6508 and 876-298-6258, or toll-free line 876-618-8248. Another question coming through Twitter, Honourable Minister and panelists. Are there any facilities to screen for mental health during this period?
Yes, absolutely. That's an important facet of what we're dealing with now. And let me just backtrack a little bit. Just sometime last year, the Honourable Minister of Health, Dr. Christopher Tufton, procured vehicles in every single parish. So we had 14 vehicles for every single parish. In addition to that, there are a number of helplines available. And when you call that number, a vehicle with the team, the mental health team, will be deployed to pick up persons. But certainly if you want to have some counseling, the helplines are also available for that as well. And it has been working very well. We have been getting the calls and we have been deploying persons, both from the Ministry of Health platform and also at the national level, where some of the calls come through ODPEM, we're able to deploy the staff to deal with those concerns.
Thank you, Dr. Campbell. Another question coming in from Twitter from Charnel. What are the contents of the care packages and how often are they distributed by the Poor Relief Department?
Okay, so the care packages consist mainly of ready-to-eat items, sardines, corned beef, biscuit, juice, and some hygiene care products as well. The distribution, we are looking at least once per week for our elderly persons. And it's the same thing for the homeless person.
And this is in addition to the 2 meals
Right, that
we provide on a daily basis. A breakfast between 9 to 11 a.m. and dinner between 1 to 3 p.m. on a daily basis right across the country. I just want to use this opportunity to say a special word of thanks, first of all, to Dennis and Geddes. They gave us $6 million worth of Malta. 1,500 cases of Malta drink has been distributed to all the infirmaries because, you know, Malta gives you some vitamin, and the vitamin is good for the infirmary. Grace Kennedy has been good. Food for the poor has been good. We have been getting tremendous support. So it is not just an ordinary package that we are giving to these people. We are giving them solid food. We are giving them an hygiene kit, and we are ensuring that 2 meals a day is provided on a daily basis.
And just to add to that as well, Minister, to boost the immunity of our residents, we have also distributed additional supplies of vitamins to our infirmaries as well as to our outdoor elderly poor recipients.
Thank you. In that same vein, Honourable Minister, in terms of the temporary shelter downtown Kingston, the Appliance Traders Limited will be providing a donation of 12 standing industrial fans. As you would have heard from the report, that there was a concern about the heat that was present at night at the facility. So ATL has stepped up to the plate, Minister, and also provided 12 industrial fans to the Kingston and St. Andrew Municipal Corporation's Poor Relief Department to support that initiative. Also, Minister, the Wisinko Group has given several hundred cases of bigger soft drinks for the homeless across Kingston and St. Andrew. And so we also, in the same way, Minister, want to express our gratitude. There have also been private persons who wish to be unnamed that will be providing food and care packages to supplement what would have been and what is being provided over these 8 weeks to our homeless population. Again, Minister, we want to express our sincere gratitude to all who have contributed and continue to focus their care. The question again coming from Twitter, Honourable Minister and panelists, what protocols are in place if someone falls ill at any of our shelters, particularly at night, to transport them from the shelter to a hospital?
You know, we're glad for the questions. We dealt with that earlier on. We have the necessary arrangements in place. There is a provider that is on 24 hours call at the facility. Their arrangements are made with the Jamaica Fire Brigade, with the St. John's Ambulance Brigade, the Red Cross, to provide medical assistance, not just in the corporate area, but right across Jamaica. We have made arrangements with private ambulance providers in areas where we don't have the services ourselves for that to be taken care of. So we do have those protocols in place.
Another question, Minister. I'm a retired nurse, over 70 years old. I'd like to assist. Is there any space for me to do that?
Well, you know, the Prime Minister has asked persons 70 and over to stay home. But at least we would welcome your expertise in whatever area, and we will get in touch with you to see how best you can assist us, because that is an area where we would need assistance also.
Thank you, Honourable Minister. Just want to bring attention to the ministry's website, which has posted several articles of activities that have taken place and continue to take place. That is www.mlgcd.gov.jm, and persons are able to review the documents and postings that have taken place. Another question from a set of students, Minister, who wish to volunteer over the Easter holiday but are cognizant of the new curfew orders. They would want to probably assist, as it says here, Minister, with the on-street feeding program. This is right across the length and breadth of Jamaica. Apparently, it's the Student Council body of Jamaica, and they would like to see over this holiday period, if they would wish to assist, how can they do so?
I am sure, in answering this question, that through the municipal corporations, if they would get in contact with the municipal corporations, and also the SDC, we would be willing to work a program out to see how best we can encourage and use these young persons to assist us with the feeding program, because there's always need for additional hands on board, because you know, as the frontline persons keep going and the stress comes, you need to have some persons replenishing that so that we can help and do what we have to do. So if they get in touch with the municipal corporations or SDC, we'll be able to sit down and work out something.
May I query?
Well, I'm happy to hear, Minister, that young persons are willing to volunteer, and as my colleague said, we would appreciate that assistance. So if you contact the St. Mary's Municipal Corporation, I'm sure we can work out a way that you can provide some assistance. But I must commend these young persons at this time.
Very well.
And just a correction to the website information is www.localgovjamaica.gov.jm. That's localgovjamaica.gov.jm. There is a suggestion on WhatsApp from Mr. Shamar Miller of Tivoli Gardens, representing the Young Jamaica group. He says, my suggestion to help the homeless is to take them off the streets and put them in a safe area and isolate them from the public, and employ persons to work in different capacities, such as nurses, cleaning attendants, and personal care assistants, to help them so that they can be in good health and in good care and preventing the coronavirus. I believe, Minister, he would have more or less encapsulated the titling and theme of this discussion that is taking place. We want to thank Mr. Miller for that suggestion. Again, we want to encourage our listeners, viewers, and participants on social media to send your questions and comments into 876-298-6508 and 876-298-6258. Our toll-free number, of course, is 618-8248. The sanitization issue, Honorable Minister, has gained some amount of traction, and a question is being asked whether this will continue as a normal exercise across all our facilities.
Yes, it is the intention for us to do that probably twice a month. The additional 120 persons that have been employed on a temporary basis, we will maintain those persons for as long as possible, and we will repeat the sanitization program that we did last week. So this is the first phase of that exercise, and we will continue another phase. Another aspect of that sanitation program is that areas within the various parishes, I know in Mandeville and in Port Maria and the other areas where these people hang out on the streets, all the areas that are occupied by those persons, we will sanitize them as regular as we can, including the infirmaries.
Thank you, Minister. Question from Facebook, Pauline Griffith-Brown. What about keeping the shelters and all street people over 65 and over, and those with underlying conditions until COVID is over? I believe that she wants to quarantine, if I'm understanding her question. And also do not allow them to leave once they come in. This would be in keeping with the mandate for the vulnerable groups to stay home and shelter in place and have better monitoring and control of them.
Well, we have already put that protocol in place. We have restricted visits to the infirmaries. No visit is being accepted. We are not accepting any new residents in the facilities, and no outdoor visit by the residents, because normally we would take them out once a week to various places. We have put all of that on hold, and there is a strict protocol that no one enters the facility without going through the necessary screening protocol. So that is already in place in all 17 facilities across the country. All 17 facilities across the country, including Vineyard Town and the Denham Town Golden Age.
Thank you, Minister. Another question coming in. How many days per week is the feeding of the homeless taking place? Is it every day or 5 days? And if so, why not 7 days a week?
Well, I guess you weren't listening. We originally started to look at 4 days, then we went to 5 days, then we went to 6. We are actually feeding 7 days a week. It is a costly exercise, but at this point in time, the cost is not important. And this brings me to a position I want to explore, and I have two mayors here, and I'm going to ask to get their feedback on it. I remember when I was much younger, there was a thing called soup kitchen, where the meals would be provided on a daily basis, where the less fortunate would go to these facilities and would get a breakfast, lunch, and dinner. I think the time has come, mayors and other members of the panel, for us to explore this possibility of having these facilities. Already it is done at the Murray Atkins facility. It is done at most of the infirmaries. But one of the things that we need to recognize is that is not just those who are actually living on the streets that are in need. You have many persons who are out there who are not actually living on the street, but really is in need for at least one good meal for a day. And it is my intention as the Minister of Local Government to explore this possibility and to make it a feature of our outreach program for the poor and destitute. Mayors,
if I may, Minister, currently Friends in Need and Candle in the Dark is just what they're doing now, because those persons on the streets would, Friends in Need serve 4 meals per day. I don't know how they do it, but they do it.
Well, remember they're getting assistance.
And Candle in the Dark, there's 2 meals per day, and it's every day of the week, because there are some other persons, as you have said, who are not living on the streets, but who are just hungry. And so they know the time of the day when the meals are being served, and so they'll go and have a meal. What they're doing now, I think, for Friends in Need is that because they're a charitable organization, they have now set up a restaurant situation where they now are cooking for not only that group, but for other persons. And I want to tell persons that when you go to the infirmary, I taste the food, I make sure that the food is okay, so people are not getting inferior food, but it is food that is cooked to a certain standard. Yes. And that is what is supposed to be happening at all of the facilities. It is food that is cooked to a certain standard. And so we will continue to explore it and to widen the gap so that other persons will be able to get. I know also at Ebenezer Home, there are about 5 mentally challenged persons who just know when it's dinner time or lunchtime, and they come in, they eat, and they leave. But just to go back quickly to keeping persons, say, quarantined, the law states that for the mentally challenged, if I'm right, Doc, you cannot lock them up. They must be given space to move up and down. And so if you would have gone to the Manchester Infirmary, what we have done is to put a fence between Ebenezer Home and the infirmary, because our persons in the infirmary, the residents, we can keep them in. but we can't stop those from the Ebenezer home from going out. And so we have done that to make sure that the constitutional rights of these persons, for they do have rights, that they are maintained.
Yeah.
Yes, Minister. In terms of your suggestion, in terms of feeding persons who are not necessarily homeless, we could accommodate this at our drop-in centers as well as in other areas throughout the parish. As you know, you are the man that holds the purse strings. So once you provide the funding, Minister, and you have been providing funding and leadership, it is something that we would be more than happy to do. The only thing with it, the only negative with it, though, is that you might open the floodgates, so to speak, and persons who are not really in need will take advantage of it, and then it becomes a situation where we have so many persons that we are catering for. But it's a worthwhile suggestion and something to consider.
Well, that is why it is good to have both sides of the political divide sitting on either side to put me back on the straight path in terms of that. But I just want to touch a point which somebody sent me last week, some concerns about persons who are offering to provide meals for persons living on the streets. And they are complaining about the quality of what is being provided for these people. And because of that, the KSMAC, following discussions with the ministry, took a position that we would put a ban, and I want to call it a ban because we have to insist that if you're not going to give these people quality food, then don't give them no food at all. And so what we have done is to organize the feeding program on the street. So what I'm saying to the public, we are not restricting anybody from assisting in the process of providing a meal, but this has to be done in an organized way, and you can't just come in a car and throw 2 boxes of food and give them and gone. No, we are not doing that, and that is why the facilities in the corporate area, we have an outpost in New Kingston, in Respiratory, in Crossroads, and in downtown Kingston, where these people come in a unified way and is given the meal under decent and considerate circumstances, not in the way that some people want to do it. And we will not lift the restrictions unless people are willing to comply.
Yeah.
Thank you, Minister. Question from our listeners in Power 106. Both sides of the story, that program, Reverend Dr. F.E. Lawrence St. Anne. Are there plans to remove children from the poor relief benefit to the full path program?
Well, you know, by law, poor relief exists by law. And the law requires that we take care of those persons who are qualified as poor. So it is a responsibility that we have. The Ministry of Labor and Social Security also works closely with the Ministry of Local Government, because there are aspects of the Poor Relief Path program that is funded and operated by the Ministry of Labor and Social Security. So the law requires Poor Relief provide these services, and that is what we are doing. And it can't be too much in terms of the services that is being provided.
Thank you, Minister. Another question, persons who are living with HIV/AIDS, are they able to access the facilities and services of the poor relief departments across the country, in particular for Kingston, the temporary night shelter?
Well, for those persons who are afflicted by HIV/AIDS, the same standard of care will be executed by the Ministry of Health and Wellness. Again, we say that you make contact with your healthcare providers to ensure that you have your antiretrovirals. There is a platform for uploading of your prescriptions through the NHF, and we encourage the use of those avenues for you to access your medication. So yes, there should be no hindrance to those persons, and particular care must be given to them as well, because your immune system is not as capable as a healthy person. So we do prioritize those persons in the healthcare system.
And I just want to make the point that the Ministry of Local Government, there is no discrimination against any individual, regardless of the person's situation. We are here to provide a service for those persons who are in need, and we are doing so within the best of our ability.
But to also say, though, Minister, that at the Manchester MC, we know that there are a number of our outdoor clients who are HIV, and the instructions are that those persons must be given special attention. So poor relief officers are working closely to make sure they get their vitamins, that their meals are prepared, and that they get their drugs on time, because we know that they're vulnerable, and we need to make sure that these persons are well taken care of.
Absolutely, yes.
Thank you, Mayor. This is a WhatsApp question from Chanel Henry of GIS. Mayor Query mentioned offering showers to the homeless, but I was informed that the practice would stop during this period in one particular parish. I guess she means St. Mary. Are municipal corporations not required to provide this act of service during this period? Minister, you would have mentioned this before.
I am not aware that we have changed our policy where that is concerned. We take directives from the Board of Supervision, so I don't know if Ms. Lewis would want to respond to that, but I am not aware that that practice has changed. They still are allowed to come to the drop-in centers and use the facilities that are there.
Our drop-in centers continue to give the service that they used to give before, which is hygiene care, which includes showers, as well as meals, and also the mental health team also comes to the drop-in centers and provide assistance for those persons, treatment and assessment for the mentally ill. There has been no such decree by Board of Supervision or the ministry.
Thank you. Question comes in from a member of both a church and a service club. Would like to know in Trelawney if they are able to provide from the church's resources supplemental goods to assist with the offering of the care packages.
Yeah, we welcome those support. As I said, we want it to be organized in a structured way, so the Trelawney Municipal Corporation can be contacted via Gager, and that will be filtered through to the ministry, where we coordinate the program of giving to these people, and we welcome the invitation to do so. I just want to make the point in discussions with Mayor Mitchell, and I've not said it to Mayor Query, but as you know, our farmers are presently experiencing, there's a glut on the market, and there is excess food. The Ministry of Local Government will be providing some $3 million to buy excess food from the farmers to be distributed to all the infirmaries across the country in a couple of days' time. I'll be making those arrangements with Minister Hutchinson when we speak, and we will be providing this funding for adequate ground provisions for the infirmary over the next 2 weeks.
Thank you, Minister. Again, we want to remind our participants, listeners, and viewers watching and listening on Nationwide News Network, NCU FM, Power 106 FM, and Mellow FM. Of course, the ministry's social media platforms, as well as those viewing on PBCJ. Our text lines and WhatsApp lines are 298-876-298-6508 and 876-298-6258. Or one you may call our toll-free line at 876-618-8888. 8248. Additional questions coming in and comments, Honorable Minister, from Mr. Nigel Cuff of Walkerswood, St. Anne, which is to congratulate the mayor and staff at the drop-in center in Ocho Rios, and that he and his wife praise the assistance that they have received from the facility and wish God's continued blessings. There is another question coming in, the on-street homeless feeding program. What plans are in place for this Easter weekend? Is anything being changed in terms of time and service being delivered to our homeless population given the new curfew hours?
That matter we discussed today in a meeting. I have just written to the Minister of National Security a copy which has been sent to the Commissioner of Police outlining what we are doing, and I've asked that consideration be extended to those persons who will be undertaking the feeding program across the various parishes. And I have listed in that letter the areas that we are asking for consideration to be given to those persons who will be providing the meals over the Easter holidays.
Thank you, Minister. There is a concern from an anonymous respondent in St. Anne asking if there are any plans for the persons living on the streets in Brownstown.
As I said before, almost every town in Jamaica has homeless persons. The same plans we have for the other areas go for Brownstown. There is no drop-in facility there, but arrangements have been made by the Central Municipal Corporation to provide those areas with food and care package.
Thank you, Minister. A question coming in from a participant in Port Maria. Is His Worship the Mayor aware of persons living in and around the Port Maria market?
Yes, we are aware, and the drop-in center in Port Maria is right beside the Port Maria market. What we have found is that there is one particular individual who visits our drop-in center that for some reason, though there are facilities provided, he prefers to stay at the market. So we have recently built a new market thanks to Minister Mackenzie, but the area he actually occupies is where the old facility was. So we are aware that we have tried to do everything to coerce him not to go there, but for some reason he chooses to stay there. We continue to work with him to see how we can, get him to relocate. But at present, yes, we are aware that there's one person that he visits the drop-in center daily. He gets his meals, he's taken care of there, but for some reason he won't leave the market.
Thank you. Another question has come in. I am an elderly person living alone, over 70 years old. I often visit the market. I am now afraid to come out of my home. Is there any facility that can assist me? I think Dr. Vernon, you would have mentioned this before.
Sure, absolutely. Just tell us your location, give us a contact number, and we'll be in touch with you, and we'll take it from there. But certainly the program is designed to provide assistance to persons exactly like you, so we'll ensure that you're taken care of.
Thank you. Again, we want to remind our participants of our text and WhatsApp lines at 298-876, of course, 298-6508, 876-298-6258, and our toll-free line is 876-618-8248. Of course, you can always visit Local Gov Jamaica. That's www.localgovjamaica.gov.jm to view, review, and download any of the content that has been provided in relation to this very important topic which affects us during this very serious period of COVID-19. There's a question from a student who wishes to find out, Honorable Minister, does the minister get any sleep?
Excellent question. us want to hear the answer
Okay.
to that one.
Minister, she's a student at Holy Childhood High School, and she's certainly enthralled with everything that you do. She wants to know, do you ever take time out to rest from these particular issues?
Well, I do get rest, adequate rest. Because when I get home, in a little while, I get to bed and wake up at a reasonable time. But I glad the student called, because there is an aspect of our that many Jamaicans is not aware of. And I want to ask Ms. Lewis just to expand on this program to show the reach of the poor relief and what we are doing for persons who fall under our care and responsibility, including children whose parents live on the streets.
Okay, so we have some 3,300 students who are registered as poor, and the Poor Relief Departments offer assistance from basic school straight to tertiary level education. Our services include providing lunch and transportation assistance to those persons, as well as any school-related expense that they may come up on. For one of the highlights of our children's program is an award ceremony that we have on a yearly basis. This year it was scheduled for March, but life has been on hold since March. We would normally have a grand awards function where we recognize the children who have excelled in the various exercises, CSEC, CAPE, and now PEP. Those children do exceptionally well. We're looking at 10 subjects, 5 CAPE subjects, passes of 95% in PEP and previously GSAT. So that program is ongoing, and for the COVID aspect of it, we have provided funding to the Poor Relief Departments to assist those children on a daily basis with their nutritional needs.
And just to say that my own constituency, I have a student now, young man who went to Woolmer's, who did so well, and he's now in his second year at Drexel University in the United States. And when his report comes in about his performance, he is one of those students who is on the honor roll at Drexel University, and he came out of the poor relief program. We have lawyers, doctors, engineers that are presently pursuing this program in various universities. And this, ladies and gentlemen, is a part of what the Poor Relief Department is doing for this extension of the population.
Thank you, Minister. Another important question from a participant on the text line is adequate security provided at the infirmaries, and are regular searches being done, particularly of the homeless who use shelters from time to time?
I'll respond to that one. At our infirmary in St. Mary, we have 24-hour security. A security company is paid, as I say, and they provide 24-hour security for the residents. Also, through the Board of Supervision and Minister Mackenzie, we also have CCTV cameras in all our wards at the infirmary. The infirmary is well fenced. So, and the second part of the question in terms of searches, what we are doing now, as was mentioned earlier, is to take the temperature of all our staff. Ms. Lewis mentioned that their garments are left and they change to go onto the wards, etc. The security does make checks. I wouldn't want to classify it as search, but staff are checked when they enter the premises and when they leave.
In Bandeville it's the same thing. We do have the CCTV situation where all the wards and the circumference of the infirmary is covered. We have 24-hour security. People are checked in and out. all motor vehicles. As a matter of fact, we're not accepting motor vehicles now. We have now created a bay, a turn bay, that if you're dropping off someone, the person comes off, go in, we do the necessary checks, and the vehicle leaves, but we are not allowing vehicles except you're dropping off food items for the infirmary. But all the necessary checks and balances are being done to make sure that the security measures of the infirmary are taking place.
And we have provided our funding to increase security by building fences where those fences were needed. And as both mayors said, we have installed our closed-circuit television camera system in almost all the infirmaries across the country. So the answer to the question is yes, we have adequate and proper security in all our facilities.
Thank you, Minister. Thank you, Mayors and Ms. Lewis. There's a question in relation to what are the additional roles of the Social Development Commission under this particular, or within this particular period, and could Dr. Vernon explain this expanded role?
Okay, thanks for the question. Let me start with what it is that we have been doing, which in fact aligns exactly with what our roles have been, generally speaking. One, we have been providing critical information for most of the communities that have been affected significantly by COVID in terms of population data, socioeconomic data. We have also been doing a lot of the tone cries, sensitization, ensuring that the messages get across to various communities. What we are now doing with the Rona helpline, we can consider this to be an expanded role, because our officers now will have to be, in the truest sense, social workers, ensure that they get in touch with each household that will be calling in to speak about issues that they are facing. So I want to use the opportunity also to say to Jamaica and say to the elderly, particularly senior citizens at home, that do not be afraid to call the lines, because you are going to be talking to persons who care, and you're going to be responsible people coming to your household, because I know the issue of security is also of concern. So there will be responsible persons coming to your household. So we continue to provide our data, as I mentioned. We continue to work with different municipal corporations to ensure we support what we can. We continue to make referrals based on what our officers will find on the ground. And in particular now with the Rona helpline, we are going to be on call to ensure that those of us who are at home, we are not detached from society. Okay.
Thank you. Thank you, Dr. Vernon. A question on the text line from Keisha. What is the protocol in place to deal with persons in the infirmaries should they contract COVID?
That sounds like a question for me, right?
Dr. Espinosa Campbell.
So let me just reiterate again. We encourage persons not to come to the infirmary, that's one, to prevent it from entering the infirmaries in the first place. If it is recognized, then the healthcare workers certainly should isolate the individual, and they have doctors that will visit and treat. And if we need to extract the person from the infirmary, then the mechanism is in place with the Ministry of Health and Wellness or any other agencies to take them to a dedicated hospital for treatment.
I just want to say, I know for Manchester, we have a doctor that is on call 24 hours. We will call him, he will check. We do regular checks. One of the things we have done too is I've met with the CEO of Mandeville Regional Hospital, because our persons would have gone there for regular electives and all of that. And so we have worked out a time frame. So if these persons have to go to the hospital, there's a dedicated vehicle that will take them there. And also for the time being, each of our infirmaries have an isolation area that you would quickly move the person to and then do the necessary checks and balances to make sure the person is okay.
If I could add, Minister, as well, in St. Mary, we have a very good relationship with our health department and our MOH, Dr. Henry. And she has assigned St. Mary has gotten, I think, 4 of the Cuban doctors. Right. One is now assigned and visits the infirmary twice per week to check on our residents to ensure that they are okay.
And just to say that funds have been provided to all the infirmaries to erect what we call isolation areas, so that if someone starts to develop any sort of situation that appears to be there's an isolation area that has been built to the specification of the Ministry of Health in all the facilities across the country.
I just want to add something else as well, because in as much as we hope never to be able to deal with that in the infirmary, the CMO has advised that there are 5 categories of persons who will be screening, enhanced surveillance will be done. Of course, we know about those confirmed already, but in addition to that, we have increased our surveillance of the influenza-like illnesses. We have the SARI, severe acute respiratory illnesses. The healthcare workers are also another category. But if you have been in contact with a confirmed case, whether or not you have symptoms or not, you also will be screened as well. So I just want to mention that we are increasing our surveillance protocols to capture more numbers, so that if it is that there are more confirmed cases, we will pick them up early.
Thank you, Minister. Thank you, Doc, everyone. There's a question from a young lady from St. Elizabeth who attends the Hampton High School for Girls, and it's a direct question to Miss Lewis, who I believe has some relationship with that school.
Barely.
You know, I passed for that school, I didn't get in, but that's another story. How do I become an inspector of poor?
Okay. So our inspectors of poor are trained social workers. The requirement is 4 or 5 CXCs, as well as some amount of social work training. There is a specialized course that is developed at the board through the ministry, where each inspector of poor has to complete before they can be appointed in the service.
Thank you. A question from Anonymous in Portland. What is expected of counselors during this COVID period, and how do they assist the infirmaries with the homeless program?
Well, what is expected of the counselors, first of all, is to comply by the restriction order that says you must not enter the facilities. But you can help the facilities by helping to provide basic needs, some of the things that are required in the infirmaries, and to educate members of your constituents, your various divisions, as to the situation surrounding the infirmaries, and because of the delicate nature of the residents, that it is best that persons stay away from the facility. That, to me, is the greatest contribution that anybody, elected or unelected, can make to assist the residents in these facilities.
If I could add in terms of the role of us as councillors now, through the Honourable Minister, some funds will be provided for care packages throughout the various divisions across Jamaica. So one of the things we have had to be doing in the last couple of days is through our network. We have a network similar to Dr. Vernon's one, but ours is a political network. So through our network, we have been gathering the names of individuals who are in need, and then once the funds are sent to the corporation, we will be looking about these care packages and distributing. It is a lot of work in order to gather all the information, and so we have submitted the names to the ministry, and we await the funding to actually deliver the care packages. So that is what has been occupying our time for the last week or so.
But I want to say, Mayor, and to back you up, because there's a tendency that people think it's for the greedy. It's really for the needy. Because some of the persons that have been calling my office are people who really don't need it. So you have to give us a chance to help those persons who really, really need this sort of situation. And there are checks and balances. We don't just give you the goods as it is. The poor relief officers have to check to make sure that you are really in need. And whatever phone number that we get, we also check it. And I want to state for the records, I've made it clear to my councillors, even though the minister didn't tell me, in my WhatsApp to them is that they must make sure both JLP and PMP get, because this is not a political thing. COVID has no color.
If I could just add to what Mayor Mitchell said a while ago, in the names that were submitted by councillors in St. Mary, it was brought to my attention that there were 2 names when vetted by the Poor Relief Department, which is the reason why we have to check this list. There were 2 teachers on the list to receive a care package. So naturally, Minister, we crossed off those.
Right.
Well, you know, the conditions that I've set as to how the funds will be released. And we have to do that, first of all, to protect the integrity of the program and prevent any unnecessary arguments about how we are dispensing with the public funds. And that is why we have done what we have put in place to ensure that we have the proper systems in place for the distribution of these care packages.
Thank you, Minister. There is a question from afar, interestingly from New York City, Ground Zero. Is there a role for the Jamaican diaspora to provide support? And can I send a barrel to support the homeless program?
You can. All you have to do is get in touch with the Ministry of Local Government, the Poor Relief Department, and engage Ms. Lewis in those discussions, and we will welcome any assistance that we can get. We are open, and I just want to encourage all Jamaicans to join us as we try to make the conditions that our homeless and those who are living within our infirmaries across the country, if we can help to make their days and nights much brighter. And thanks for the offer.
Thank you. And coming down to the final question section, Minister, I think this is for Dr. Campbell. I am a third-year medical student. How may I offer assistance? At all, maybe for both Minister and Dr. Campbell.
No, that is very good. Thank you. Just recently, the Ministry of Health and Wellness incorporated 80 medical students to man the call centers. So if it is that you wish to volunteer your efforts, can I ask you to just make contact with the ministry through the helplines and submit your name and contact information, and they will certainly screen you and vet you and then put you on that program as well. So thank you for your offer of assistance. We need the help.
Thank you. The last question, which I am able to take, is that from a young 11-year-old student who is, he says, bored at home doing homework and would like to know how he can participate in a live town hall meeting to show the interest of children and sit beside Minister Mackenzie.
That is so gracious of you. I know it is tough at this time to be home, not being able to express yourself in the way you are to. But let us see if we can arrange another such town hall meeting where we can engage the future leaders, which are the junior mayors and councillors, which we will invite you to be a part of that later on this year. So just give us your information and we will ensure that we engage you in this program.
Thank you, Honourable Minister. I believe he is looking forward to that. At this time, I am going to throw back to the panelists to provide us with their closing remarks, which will be the final speaker, of course, will be Minister Mackenzie. So I will start with Mayor Query.
Thank you very much, Mr. Moderator. Just to say that through the leadership of Minister Mackenzie, which has been sterling leadership since he took charge of this portfolio, we at the St. Mary Municipal Corporation will be doing everything within our power to take care of those residents at our infirmary and also those outdoor poor that we take care of that Ms. Lewis spoke about. Those outdoor poor in St. Mary, we have about 519 persons that we take care of by way of our poor relief department. So we will be doing what is necessary as we are providing them with care packages. We are providing funds. We are providing food. We have provided additional staff members to help in the care process of our homeless and our persons at the infirmary. We look forward to providing our residents in the various divisions with care packages as well. Minister Mackenzie has provided $600,000 per division to provide those care packages. I know persons eagerly await the packages. We eagerly await the funds. And once we get it, those packages will be passed on to our residents.
Thank you, Mayor Creary. Mayor Mitchell.
Thank you. Again, I want to thank Minister Mackenzie because, for the want of a better word, he's like a godfather. There are some persons like Creary who say that him don't understand that once I call minister, I get something done. But you see, it's good representation on behalf of the people of Manchester. But I just want to say that the Manchester Municipal Corporation, we have been doing our best to make sure that our residents, our outdoor poor, and all those other persons that we have to take care of is taken care of. Because I made mention to some persons the other day, and we're doing a new building which is 99% complete, and somebody says, how you take so much time to make sure that building is being done in that way? And I said to them, God owes the key of all unknown, and I don't know what can happen, because there are persons at our infirmaries who are doing very, very well in their younger days. I know one gentleman who, just because of an accident, his family just can't take care of him, so had to be placed in the infirmary. So I will close by saying, just remember the words of Jesus Christ in St. Matthew chapter 25, verse 44. In as much as you have done it to one of these little ones, you have done it unto me. And that is what I am doing, and that is what we are doing as a people.
Thank you for those wise and timely words, Mayor Mitchell. May I invite Dr. Espinosa Campbell to bring her closing remarks.
Thank you. It is often said that the old persons are God's work of art, and we want to preserve them. I'm happy that Minister Mackenzie has put this thrust into recognizing this vulnerable group of persons, and I know that, the Chief Medical Officer is to be applauded as well, because she has steered this country very well in keeping our numbers down. She has ensured that the curve remained flattened, and to all those persons within the Ministry of Health and Wellness that are working beyond their call of duty. We know it's hard work, and we are committed to providing the necessary support for the country. And certainly, the COVID-19 has taught us a lot, not only as a ministry, but as the agencies work together. I mean, just on this very platform, we recognize the work of the SDC, the Ministry of Local Government, and I must say that their efforts help us, because certainly when we quarantined Bull Bay, we had to rely on the information provided by the SCC to identify the vulnerable persons within those communities, to ensure that the care packages were given out to them in a timely manner. And, they are very important. So I want to encourage us as Jamaicans to continue the hard work, be vigilant. I have been getting a lot of calls through the ministry and also at the national level of persons who may not be complying, but certainly the calls are coming in, and we see where the concerted effort has been made by each and every one of us in curtailing the COVID-19. So keep up the good works.
Thank you, Dr. Campbell. Dr. Vernon?
Sure. Thank you. Just to say that, please remember the Rona helpline. Senior citizens at home, you have avenues that you can call us. We will be in touch. And to the staff of the SDC, be ready as usual. Be ready, be professional. To the minister, I must also say thanks. And to Jamaica, stay safe. We are here.
Thank you, Dr. Vernon. Ms. Lewis.
Just very briefly, the policy director at the ministry, the Honorable Minister, will not allow us to fail. So I'm just saying that rest assured that the most vulnerable persons of whom we speak will be properly cared for.
Thank you. And now I invite the Honorable Minister Desmond Mackenzie to close the program.
Let me say, first of all, thank you to members of the panel. We have had 2 good hours of discussion as we look at the plight of the poor and destitute in Jamaica. As the minister with responsibility, the Most Honorable Prime Minister, have given me this responsibility to lead the charge. This is something that has to be done collectively, and that is why today I have both sides of the political divide represented here on this panel as we look at the most destitute in the society. I want to thank the caregivers within these institutions for the work that they have been doing and for the support staff of the municipal corporations across the country. I want to urge my fellow Jamaicans to think about these less unfortunate. Many of these persons that fall in this situation were once taxpayers, contribute significantly to the growth and development of Jamaica, but has fallen on hard times. It is the commitment of the Andrew Holness administration to ensure that we do everything that is humanly possible. I want to wish them all a happy Easter and to extend to all Jamaica best wishes over this period and say to all Jamaicans that the greatest remedy for the coronavirus is the response of us as a people in this struggle. Thank you to those of you out there in Radio Land and on the social media page. 100% thanks, and God bless you all.
Thank you.
Thank you, Honourable Minister. This has been the Digital Town Hall focusing on the homeless and infirm, hosted by the Honourable Minister of Local Government, the Honourable Desmond McKenzie, here at the offices of the Ministry of Local Government and Community Development at 61 Hagley Park Road. Thank you.
Today we officially launched the sanitization program, the extensive cleaning programs that the government announced for infirmaries and golden age homes. We started today in 4 parishes: Kingston, Clarendon, St. Mary, and Trelawney. What we are seeing is the Jamaica Defence Force, Jamaica Fire Brigade. We're seeing ODPEM, the KSAC, and just the National Solid Waste Management Authority coming together in cleaning this facility. So they are working to scrub the walls, do the sanitization, and we are expecting that when this is done, we will have a much more secure facility. Each institution across the country will employ temporary workers for about a 2-month period. So if the complement here at the Golden Age Home is 15, then they would employ 15 additional temporary workers. And their job is to go through the facility on a daily basis, minute by minute, wipe, scrub. Because as you know, they say the virus can stay and the virus can be transmitted. So we are doing that right across the infirmary. We are expecting that about 120 persons will get additional temporary employment from this exercise.
Coronavirus is in Jamaica, and I know you feel scared and worried. But you can't let COVID-19 divide us.